Hey guys, it's Paul at USA Health Insurance, one of the health plan advisors. You've probably seen me in a few different little podcasts. Well, here's one that I thought we needed to do. I got a question at the website. How can I find a health insurance policy to cover my diabetes? I have been turned down by multiple insurance companies due to my pre-existing condition, and the plan that I'm on right now is the rates are going through the roof. Help! Exclamation point. Well guys, this kind of stuff comes up countless times a day. As we all know, the system as it existed is underwriting, or based on underwriting, which means these insurance companies have been able in the past to ask questions about your health history going back 5, 10 years, however long it may be. And if they didn't like your health history, they had every right in most states of the union. There's a few exceptions where they could turn you down for a policy or come back with a higher rate or exclude your health condition. Hey, the Patient Protection and Affordable Care Act of 2010 has changed all that. What is popping out of the bushes at this point is that all plans are now guaranteed issue, which means that they're not going to ask health questions anymore. Your rate will be based off of just 4 factors. That's it. How old you are you male or female, what's your zip code, where do you live, and then are you a tobacco user? And once again, I've touched with this in other podcasts. Hey, tobacco users, heads up. If you use tobacco, now's one of the biggest incentives you've ever had to try to stop smoking or quit, using chewing tobacco or something. The government's going to hit you with a whopping 50% rate increase next year. It's the only thing they can rate on. I'm not agreeing with how much that increase is by, but hey, heads up, because here it comes. So getting back on note for what we were talking about. So I've had this health condition, diabetes in this case, and I can't get a policy. Well, now you can, because they're no longer asking the health questions. Your rate will be, if you are a 45-year-old woman living in Houston, Texas, with diabetes, your rate's going to be the same as any other 45-year-old woman living in the Houston area who's non-tobacco. We're assuming both are non-tobacco, with health history or without health history. Doesn't matter, they're not going to ask the questions. Rates just based off those 4 items, guys. So, how can I help someone with diabetes? Well, the first primary thing is you've got to call and use my expertise. Don't be afraid to call and talk to a live human being, guys. If you buy a plan directly off the internet and you never talk to a live human being, don't be surprised when you get burned on your policy. There are too many nuances in this stuff, too many details, especially next year. From what we've seen, there are absolutely tons of health insurance plans that are going to be popping up on the healthcare exchanges. And just like now, people need guidance walking through the jungle tangle of all the different options that are out there and what is going to work the best for my family. Sure, these plans are guaranteed issue. However, what you're going to find is you're going to have a lot of different products. You've got the 4 different types of plans that are going to be on the exchange, actually 5. The bronze, silver, gold, platinum, the catastrophic plan available for hardship or under age 30. You're still going to have different benefits. One of the biggest changes in how they're going to control costs in the future is different networks. Hey, it's great that all the plans have a PPO plan or a PPO network now, preferred provider organization, and you've got 90% of every physician in the United States to pick from. Honestly, if you're living in Georgia, when's the last time you used a urologist in Utah or a cardiologist in California or Washington State? You're not. So they're shrinking those networks down to help control cost. And is my doctor covered? Is my hospital covered? That's going to be a big issue for the future, and it's every insurance company, from what I've seen, is going to have multiple networks, just like they do now. How do you know which one you're looking at? Is it the correct one? Asking my doctor's office, do you take Blue Cross, is not going to help you, because in their defense, they deal with countless insurance companies, and when each insurance company has different networks, the folks there don't know what they're looking at. That's not their job. Their job is to take care of you, run the claim based off your insurance card, and leave it at that. So once again, guys, it comes down to expertise. Call us, ask questions, speak to one of the health plan advisors like myself. My name is Paul Phil. One of my associates is Jeff Moody. Both of us have extensive experience dealing with these different insurance plans in just about every single state of the union. We've seen how these plans have changed over the past decade and where they're going with what's happening in the future. So if you need a plan due to a pre-existing health condition, and what started this particular podcast was diabetes, but it could have been you're getting turned down due to your height and weight. You're getting turned down due to cancer, heart attacks, had a stent put in. There is a laundry list of health conditions that insurance companies will automatically turn you down for, and that's changed. So give us a call. Let us guide you through the multiple plans that are out there and try to make this a little bit easier of a process and easier of a search.